Hello people, in this video we want to look at alkaline phosphatase. So basically alkaline phosphatase enzyme made by bone, liver or even placenta. Okay. So this alkaline phosphatase is enzyme contains zinc. So we are looking at the serum alkaline phosphatase levels. That means in the blood, why can it increase or decrease, etc. So what is ALP? That is alkaline phosphatase. This is, they're saying it is a collective name given to many enzymes. Okay, so it is not a single enzyme. It is it's several different enzymes together. And what do these enzymes do? They will hydrolyze phosphate esters, okay, at an alkaline pH. What do? They hydrolyze phosphate esters, okay, at an alkaline pH. So that is why they're called as alkaline phosphatase. Okay, so they're going to do some phosphatase activity. They're going to hydrolyze phosphate at an alkaline pH. So alkaline phosphatase. Fine. Where are the main sites of production? Liver, gastrointestinal tract, bone, placenta, kidney. Looks like there are many places it's made. Okay. Gastrointestinal tract, bone, placenta, kidney. Here mainly we'll be focusing on what? Bone, liver and placenta. Okay. Then what else you should know here? So once this ALP is made, it is there will be several modifications of it, several different isoenzymes. Okay, it will be there in different tissues. Guys, this ALP can be raised in puberty. Okay, because of this metabolism is being more in bone metabolism. Then in pregnancy also it can be more. Okay, so these are some of the green things you should know. That is good things where it is raised in whenever there is puberty, right? Bone metabolism. That time you will have more of ALP, and pregnancy also you can have more of ALP. But this sounds about nice, right? So there is mineralization of bone. That and all we like. So most of this is green. Puberty, pregnancy, all this seem very nice, right? But ALP can rise even in bad things like liver disease, in bone disease, in secondary hyperparathyroidism, some infections like some virus like cytomegalovirus, abdominal tuberculosis, and then candidiasis, fungal infection. Then in some tumor conditions like seminoma, right, and then ovarian dysgerminoma. Both of these are counterparts only, right? So this is of seminoma testis. In these conditions also it can increase. If there is some other conditions also it can increase. Okay. So anyways, we'll first start off with the good thing, the bone metabolism, right? In bone metabolism. So basically what they're saying is, this osteoblasts are there, right, in the bone. So now we are looking at bone and the good thing, okay. So bone mineralization. So osteoblasts will release this enzyme. That is, which enzyme are we talking about? Alkaline phosphatase, and that will help in mineralization. How does it help in mineralization? It actually inhibits the enzyme that helps in demineralization. That is how it helps in mineralization. See, this enzyme, what it does, ALP, it degrades pyrophosphate, which is an inhibitor of mineralization. That's how it helps in mineralization of bone. Okay. So from where is the ALP coming? Here we are talking about the bone metabolism. Okay. What happens in puberty then? In puberty, adolescence, etc., they are talking about increased level of this ALP. Okay. Because of skeletal growth. At this point, what is happening? Skeletal growth. So this is a good thing only. So we put like this. So it will peak in these ages, etc. You don't have to remember so much. These are the values that the textbook is talking about. So alkaline phosphatase, less than 1 year, how much it will be? Around 80, then around 16 years, it is 100. Okay, but slightly less in females they are showing here. Okay guys, once the epiphysis is fused, adult levels of this enzyme are reached, they are saying. Anyways, just remember it is important for the skeletal growth. Okay, and the third thing you saw was pregnancy. In pregnancy also it can become more. Why? It is being made by the placenta. Actually, it is being made less by the liver at this time, but placenta is making it more. Okay, so here they are calling this as PL, placental alkaline phosphate kind of a thing. Okay, PLAP also they are saying. This is from placenta. Okay, so now let us go to the other things. So we are going to the red ones, guys. Are you focusing here? So we finished what and all? Bone growth, bone metabolism. Then we looked at puberty and then pregnancy. Now let's go to the other things which we have marked as red. See, liver disease. If there is liver disease, can you say liver disease?
Liver disease.
Bone disease.
Bone disease.
Infection.
Infection.
Tumor.
Tumor.
So liver disease. So what happens in liver? See, liver is making this enzyme, and it will be there in hepatic sinusoids and biliary canaliculi. However, if there is obstruction, here the word is for you, obstruction. If there is obstruction, make it bold. Yeah, if there is obstruction, then you will see rise levels of this ALP. Okay. Look at this. If there is biliary obstruction, ALP has increased so much. If there is hepatitis, it has increased. Okay. Alcohol doesn't help do anything. Just remember biliary obstruction and hepatitis. That's what they're trying to say, right? So liver disease we have completed. But here there's one extra point that you should know. If with this ALP, if this gamma glutamyl transferase also has increases, it will tell you that it is obstructive, favors biliary obstruction and commonly described as cholestatic or obstructive. So both should be raised if you want to if you think it is biliary obstruction, right? Obstructive, yeah, favors biliary obstruction. Both if they are raised, you can confirm, or you can are they sure? Yes, it is favors biliary obstruction, they are saying. Okay, so we are done with this hepatic or obstructive raised ALP. Now let's check bone disease. What say people? Shall we check bone disease? ALP is increased in almost all bone conditions, guys. If there is osteoporosis, it's more. If it's Paget's disease of bone, that is where there is a softening of bones and bending of tibia and all, right? Because of improper modeling and remodeling, right? There's no balance. So that time Paget's disease of bone also, ALP is increased. Renal osteodystrophy also, it is increased. Some kidney and bone osteodystrophy. Then vitamin D osteomalacia. Malacia is also softening only of the bone, right? In that also there is increased ALP. In hypophosphatemic rickets, hypophosphate less, hypophosphatemic is rickets, but ALP is more. Then primary hyperparathyroidism also, it can be normal or more. Okay, so everything to do with the bone, skeletal diseases, ALP would be more. Okay, tell the names. The names are osteoporosis, Paget's disease of bone, osteomalacia, renal osteodystrophy, very good. Then hypophosphatemic rickets, yes, very good. Very good. So all these are the skeletal diseases. Now let us go to this, this one, secondary hyperparathyroidism. In the table I had written in primary, it can be normal or raised anyways. Now let's go to infections. Some infections also there can be raised ALP. This usually is because of liver involvement. That's it. Okay. In abdominal tuberculosis due to liver involvement. In CMV, see LFT is normal, that is liver function test is, abnormal. So alkaline phosphatase level can be raised. See, ELISA can detect ALP in virus. Somewhere we had read this in 12th, right? ELISA can detect ALP, they are saying. So cytomegalovirus infection, candidiasis. So chronic disseminated candidiasis, hepatosplenic candidiasis. That itself is giving you a clue. Hepatic. I think we should move this here because of liver involvement, right? So let liver come everything together, right? Then after liver, we will look at bone. So we have moved this up, okay? Now bone, okay. Then tumor markers. So it is not just about bone disease, liver disease. It can also be because of tumor marker for seminoma testis, ovarian dysgerminoma. Can you remember this at all, guys? Come on, say. Where and all will you see raised ALP? As soon as somebody tells you raised ALP, bad one. Oh yeah, liver disease, bone disease. Liver affected because of any infection. Very good. Bone disease, yes. Then any tumor like seminoma, dysgerminoma. Very good, very good. Okay. So this is all about raised ALP. Okay. So hope you have learned alkaline phosphatase. It's a group of enzymes they are saying. Okay. Bye bye.